Hey, it's Dr. Hannah with this week's Hot Topic. Today I want to talk to you about something that most of us have done. Some of us have done it once or twice. Some of us have done it really bad, but that is spraining your ankle. So what you should do when you sprain your ankle is follow RICE and get adjusted. So what RICE stands for is rest, ice, compression, and elevation. Rest is kind of self-explanatory. If you sprain your ankle, get off your foot. It hurts. Your body's telling you that there's something wrong. So don't try and walk around or walk it off or anything. You're going to do more damage in the long run if you just get off your foot. Second thing is ice. Ice for 20 minutes, rest for 40 minutes, ice again for 20 minutes. You can do this as much and as often as you can in that first initial 24 to 48 hours after you sprained your ankle. If you don't have an ice pack, you can take really, really cold water, throw some ice into it, and then submerge your foot. It'll do the same effect. I prefer that method, but some people they don't do well if they submerge like in really, really cold water. Make sure it's not super cold that you're gonna give yourself hypothermia, but you want to do this for 20 minutes on, 40 minutes off, 20 minutes on again. Again, as much and as often as you can. The first 5 minutes, if you're going to submerge your foot, is the worst, and after 5 minutes, it usually feels pretty good. The third thing to do is compression. So you want to take an ice bandage and you want to wrap your foot. You don't want to go closest to the heart, away from the heart. You want to do it furthest away from you to closest. So start at your toes and then go up the leg as far as you can, depending on the size of the compression wrap. You don't want to do it super tight that it's cutting off your circulation, but you don't want it so loose that it's not really giving you any support. So what this is going to do is decrease some inflammation. It's going to help promote healing, and you just want to, again, prevent that swelling. So that's what the compression is doing, so it's super important that you do that. Just don't do it too tight. The fourth thing that you want to do is elevate. So get your foot above your heart. Gravity is going to take care of that swelling. If it's super, super swollen, it's going to be really painful. It's also going to slow down some healing. So getting that foot up is just going to make your healing time a little bit shorter. Then the last thing you can do is come get adjusted. I know thinking about getting adjusted after you sprained your ankle probably doesn't sound great. I know when I sprained my ankles when I was in sports in high school, it really didn't feel good initially when my dad was adjusting my foot, but I healed so much faster than a friend who had sprained their ankle and didn't have their foot adjusted after they've done it. So getting adjusted afterwards and putting mobility into it as fast as you can after you sprained it is a really, really good thing. Now, there are 3 different kinds of sprains that you can have. One is a grade 1 sprain, which is, it's kind of normal where you don't really have any tear, you have swelling, you have inflammation, it hurts. This can usually take you about 5 days to 14 days to completely heal from a sprained ankle. So grade 1 is like no big deal. Grade 2 is a little bit more moderate. It can usually take 4 to 6 weeks to heal. There's some significant ligament injury. You might have to have a mobilization or a brace to kind of give you some more support. And there's a lot of excess stress in the ankle, stretch in the ankle that really shouldn't be there. The last type of sprain is a grade 3 sprain. This one's really, really bad. It usually takes about 4 to 6 weeks to heal. You could have torn some ligaments. There's a lot of severe bruising and swelling. The ankle's super unstable. Walking's probably not possible, so you might need crutches. You might have to be in a boot or a cast, and this one you might actually need surgery. So depending on the severity of the sprain, could take 5 days to heal, or it could take up to 6 weeks to heal, depending on what you've done. But as long as when you sprain your ankle, you follow the RICE and you get adjusted, it should hopefully help your sprained ankle get better a whole lot faster. That's all I have for you this week. We'll see you guys next time.